Trying to get pregnant when you're 40 and older. Hi, friends. I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI. So I'm a fertility doctor. And every day I talk to people about how they can get pregnant and what they need to know ahead of time. And you've probably wondered, if you're watching this video, about how you should approach things differently if you are older when you are starting instead of younger. And a big question I get asked is, can you get pregnant at all naturally if you're 40 and older? And the short answer is yes. But your biology is different. There are things you should know. And my approach as a specialist who does this day in and day out is different than if you were 30. So you should know this information also so that you can make the most data informed decisions. Before we jump in, I just want to say thank you so much for being here. As always, you help grow this channel. So thank you for liking, sharing, commenting, subscribing. It really matters so much. A recent study came out showing that for the first time in US history, more women were getting pregnant in their 40s than in their teens. There's many different reasons for this, and ultimately this is good news. It speaks to women being able to achieve families later, chasing big dreams and careers, and also having access to reproductive technology. This video is not anti-IVF. You know that I do IVF in and out every single day. And there's no denying that if you're 40 and older and you'd like to have more than one child, please go see a fertility doctor like me to talk about IVF, because we do want to make sure you've explored every option. But if we're just saying, hey, what should we be doing if we try to get pregnant? One of the biggest issues that I see is people just start trying. And maybe that approach works when you're 25. But even then, infertility is failure. It is defined by not being able to get pregnant when you've been trying for 12 months or more. Now, when you're 35 and older, we recommend that you do an evaluation after 6 months of trying instead of the 12. But that's right. For both of these, you do not get evaluated until after you've already failed, till you have not getting pregnant. Then that is the first time that we will go and even do any testing. So why wait when you know things are going to be a little bit harder when you're older? So if you're 40 and older, I actually recommend you go get tested right ahead of time. Trimester 0, the prep for getting pregnant, is even more essential. Your time is your most valuable commodity, and we should be making really good data-informed decisions. But why is it harder to get pregnant as you age? Well, many people think it's because you run out of eggs. And even though we all do run out of eggs as we get older, that's not typically the rate limiting step for you getting pregnant. Most of the time, it's actually the egg quality, which does decrease as you get older for two reasons. And I want you to think about egg quality being both the genetic normalcy and then the function of the eggs. What this means is that you're born with all the eggs you're ever going to have. I like to imagine them as kept in a vault inside your ovary. Now, every month, an entire group of eggs is sent out of the vault. Each egg grows inside a follicle. The brain's going to send out FSH, or follicle stimulating hormone, and FSH gets one follicle to grow. As it grows, the egg matures. That's what you ovulate. The rest of the follicles or eggs die. Next month, you have another group. As you get older and you have fewer eggs are in the vault, and so fewer come out every time. And eventually that does make it harder because you will start to see some abnormalities to the ovulatory pattern. But even in the in between, what we start to see is that even when you're still ovulating perfect, you have a good egg count, is that because your eggs have been in your body your whole life, we start to see a deterioration to the genetic normalcy or to the egg function. To a degree, some of this you can't change, but some of it you can influence. And that's the empowering message that we need to understand. I like to think about the science and explain that. So inside your eggs are chromosomes. So your eggs are 46XX and they actually split. They're paired up with their mate and they split into being that 23X at the time of ovulation. So I want you to imagine they're held in this perfect position, being held apart by these meiotic spindles, which are proteins, keeping them in place until you ovulate and being pulled apart. So a 25-year-old has had her eggs held in this perfect position for 25 years, but a 40-year-old has had them held there for 40 years. Because of this, we see breakdown in when they're splitting, pulling abnormally. And the analogy I like to think about is a line of kindergartners, and the longer I ask them to stand there, the more problem there will be. But the other side of that puzzle is the functionality of the eggs. Because as we are exposed to chronic inflammation, autoimmune disease, insulin resistance, environmental toxins, this can actually deposit and cause fibrosis inside the ovary, making it harder for the ovary to respond, can actually directly damage that egg quality as well. So that even if you have genetically normal eggs, they may not divide and function normally because of the environment of which they're growing. This is the metabolic health of the egg or the ovary and the functionality. That's also a huge piece to egg quality. Yes, your eggs are in your body your whole life. So to some degree, like, what can you do about this? But the other piece is that we know eggs get closer to the surface of that vault and they are most sensitive to the world around you in the 60 to 90 days before you ovulate. So this means this is the opportunity when you can intervene the most and really think about trying to improve your egg quality. So, in addition to understanding your data, so early testing, I want you to improve your egg quality and we want to track our cycles so we can detect hormone abnormalities faster. So, understanding our early testing, one of these is going to be testing your ovarian reserve. Ovarian reserve is a marker of how many eggs are outside the vault. And because when there's more in, more come out, your ovarian reserve test will be higher. I think everybody should get an AMH, but specifically if you're older and trying to get pregnant, this is helpful. AMH doesn't mean you can't get pregnant. It might stratify the length of time you have until your ovarian function becomes impaired. But AMH is directly correlated with how many eggs we might get as IVF. So if we think about IVF even as our backup plan or a potential option on the list, AMH matters a lot when we talk about expectations. I like to say, hey, it's just a marker of where we are now. We don't have a rate of decline. It does fluctuate month to month. It's imperfect, but it is helpful. Number two is we want an anatomical evaluation inside of the uterus, fallopian tubes, a vaginal ultrasound with either saline or an HSG test, combination of the above. But if your tubes are blocked and you need IVF, sooner the better. If you've got a polyp in your uterus and you need a hysteroscopy, the sooner the better. So we want to identify these problems early and not later. We also want to check some other blood work specifically for things that are more common as we get older. Think vitamin D deficiency, a ferritin level for iron deficiency, a thyroid panel, and a fasting insulin for insulin resistance. We see that our metabolic health changes as we get older, and we want to be ahead addressing these factors. And then we also want to check a semen analysis. Male factors 50% of the time. If you're trying to get pregnant at an older age, sperm does change with age also. Not saying that your partner is the same age, but we know that sperm quality changes. We know that genetic normalcy and the fragmentation inside the sperm changes and the functionality. So at least knowing what you're starting with is so important. So early testing, ideally before you even want to try to conceive. Lifespan of a sperm is 90 days. So this is thinking about how do we improve metabolic health, decrease that insulin resistance, improve your response. So sleep, managing stress, anti-inflammatory eating, avoiding the ultra-processed foods, avoiding the environmental toxins, building muscle, especially in that 3-month window before you start trying to get pregnant, and taking a prenatal vitamin and some male antioxidants. That's going to be only advantageous. But then lastly is don't just pull the goalie and try, right? Don't just shoot and waste your shot. You should make very targeted efforts when you're trying to get pregnant. We know that at age 40 and above, your odds of getting pregnant per month are going to be at best around 5%. That's not zero. That feels low. When you're 30, at best, that number's around 20%. But because we know that that's in the perfect scenario, we want to try to optimize and have the perfect scenario as often as we can. So I want you to track your cycle. When you're tracking your cycle, not just when your period is coming, but I want you to say, when am I ovulating? And this is either going to be with basal body temperature tracking, typically connected, like I like natural cycles, using urinary hormone measurements. This could be with an ovulation predictor kit or a more advanced system like Anito, or it could be leveraging your cervical mucus so that we can see what is happening because we know we get that type 4 sticky, stretchy cervical mucus as you're approaching ovulation when your estrogen is its highest level. Having intercourse on a day where you are ovulating is one of the top things you can do to get pregnant faster. The egg only lives for 24 hours. Sperm can live in the female reproductive tract for up to 5 days. And so we say the fertile window is the 5 days before and then the day of ovulation. This is when you should be having intercourse. You don't have to save up sperm, so there's no reason to abstain until ovulation day. Because sperm are made 1,500 sperm per second, if you have frequent intercourse, just keep at it. If you have everyday intercourse, have everyday intercourse. But if you are not, then really trying to target that day before, the day of ovulation are going to be the 2 highest days when we're trying to get you pregnant. So really thinking about preemptive testing, optimization, and then tracking so you have really highly efficient cycles. And then getting help immediately if you're not pregnant within 3 to 6 months, or if you can't detect ovulation, if you're having pain with intercourse, really painful periods, a lot of spotting. If your partner's having erection, ejaculation issues, do not pass go. Go get the evaluation so that you can be in that place to make an informed decision. The take home message is that you can get pregnant after 40, but you need to know your numbers. You've got to advocate for your care more. The decisions you make do matter, but it is absolutely possible. I like to view all the tools in the toolbox. It's never wrong to see a fertility doctor, get fertility testing, understand the options, and then make the informed decision on when it's right to advance care if that's what you're looking for. As always, thank you so much for listening. Please check out Instagram at Natalie Crawford MD. You can also check out my book, The Fertility Formula, for more information.